Hey guys, I wanted to take a little bit of time and go through some information about the COVID coronavirus pandemic and ensure that you know how to access resources from our hospital or from the LSU system, specifically related to coronavirus. And at the same time, I want to be sure that you're all prepared to properly put on your personal protective equipment and take it off so that you're keeping yourself safe and your patients safe. So this is just a really quick video to show you how to access those resources, and I'd like to play a video that goes through the steps of taking on and off that equipment. So bear with me. This is not a formal video session by any means. But again, I do want you guys to feel prepared. So I'm going to show you sort of where to go. Interestingly, I do feel like the LSU Pediatric Chief Resident website is, for me, the easiest place to access information. And that's really where I go to for a lot of my resources because I know that it's the most up-to-date and easily accessible. So let me show you how to find that. So I'm going to Google LSU Pediatric Residency and click on our web page. So this is kind of our home page for the department with a welcome address from me and Dr. Watts. And we'll be making some edits to this throughout the year as we prepare for a likely virtual recruitment season. But you're going to click in this left-hand corner column over here, Residency, and then click on Chief Resident Website. And so now that you guys all have your email addresses and credentials, you should be able to log on to this without much difficulty. So this is the Chief Resident website. We do keep it password protected because we have lots of information for our residents on it, including schedules, and we don't want the general public to be able to access those things. The chiefs will walk you guys through this as well as kind of what's on here, and I would encourage you to take some time to explore it. There's lots of fun pictures and goofy videos we've been making in our virtual times, but I want to point you to this link right here to get some of your up-to-date coronavirus information. And again, lots of different options. The one that I want to focus on today is this LCMC/Chenola information. So that's our hospital system. And so up at the top, you'll see that we've actually been adding things as time surpasses. And especially now that we're in this process of seeing some patients present with the MIS-C syndrome that you've been reading about, we have algorithms that help us guide management of those patients. But if you have time before you start residency and you want to feel more educated and prepared in terms of the coronavirus things we've been doing, you can take some time to look here. But I want to focus a little bit also on PPE, so personal protective equipment. And I want to make sure that you guys know how to properly put it on and take it off. And that's what this video here is for. So let's watch it together. I don't think it has any sound, but this was put out by the LCMC system. And some of our gowns are this blue gown, and some of our gowns are the yellow fabric gowns that you actually have to tie. So it just depends on the floor that you're on. We're going to go over the situations that you would need the N95 respirator as opposed to just the classic surgical mask. So you keep your mask on until you leave the room. And before you touch your mask, since you just touched your dirty goggles or face shield, you need to re-sanitize or re-wash your hands. And then again, you just touched your mask, which was contaminated, and so you need to wash your hands a final time. And this is happening outside of the room. If the patient's in an airborne isolation room, this would be happening in the ante room. But you remove your gown inside the patient's room and then walk into the ante room. So again, I just showed you how to access this, and I would encourage you guys to continue using it as an option. To sort of review and know what to do. Regarding the availability of personal protective equipment, we have not had any major issues in the hospital setting. Everyone has been able to have the access to those resources. There are specific protocols that dictate when a patient requires that the provider wears an N95 mask, and I'll show you how to access and look at what that would be. In addition, in terms of masking period, at this point in time, anyone entering Children's Hospital is required to have a temperature check at entry, and they do a list of questions to ask about symptoms. And then everyone is provided with a wristband stating that they've had their temperature checked and they're clear to navigate throughout the facility. And also they're provided with a plain surgical mask to wear throughout the day. And the only time that you shouldn't be wearing those at this point within Children's Hospital would be when you're eating or drinking, or if you were in like an office space alone, or were able to be in a very small group setting with proper social distancing. But really you should keep that mask on unless you absolutely need it off to eat, to drink, etc. Okay, so let's go back to the Chief website for me to show you a few other things. And these signs will be posted on the doors. So a patient will be deemed either level 2 or level 3 PPE based on some criteria that the hospital has predetermined. And so level 2 PPE, you'll see a sign that looks like this. And you'll know that you use a surgical mask instead of an N95. Okay. And then for level 3 PPE, that would be when you actually do the airborne room, and an N95 mask must be worn. So this sort of goes through those steps to show you. And then in case you're curious, we do have how to reuse an N95 mask. At one point, for about a week and a half, there was a scenario where some providers needed to reuse their N95 mask when there was a national shortage and the hospital had a shortage. But at this point in time, we are not in the process of needing to reuse those because our algorithms have been adapted to require those when during aerosolized procedures, etc. And so if you wanted to know how it's determined, what sort of precautions a patient is placed on, you could go to this document and it sort of walks you through. If the patient has the, X, Y, and Z, then the patient needs this and the staff needs this. And so you can see here an N95 mask would be required if the patient met these criteria. And especially this aerosol generating procedures, which are listed for you down at the bottom. So again, lots of helpful resources here on this website. And these are resources provided by Children's, but we try to put them all in one place for you guys so that it's easier to access. We do also have algorithms in case anyone were to be exposed or to be symptomatic and concerned that they themselves had coronavirus. And the chief residents and I have made ourselves as much of experts as possible on these algorithms. So any resident experiencing symptoms or concerned that they are infected walks through those questions with us initially, and we direct them to the hospital employee health line to help also to direct further guidance, which typically involves testing to determine some return to work criteria, and those are all listed here. Positively speaking, I think we've had a few residents out with symptoms, but only one resident test positive who did very well and ultimately was out for the time frame because of the needed time to be off and not because her symptoms were severe. So again, we're here to look out for your safety and your best interest, and everything that we do every day surrounding this is truly to keep you guys safe and to keep you guys protected. So take some time, look around on this chief resident website. Again, so much other information just about coronavirus, including some things we put out there for health resources for ourselves and some wellness things to do for yourselves. But then again, also lots of things to peruse on this chief resident website altogether. Write down any questions that you have. I'm going to go over those questions with you in our live Zoom session Q&A time period on June 22nd. So if you need to look back through this and develop any questions, please do so. I will show you two other things really quickly, and Kelly will email these to you guys so that you have them as links as well. Let me share something different. These are actually posted throughout the hospital, so it actually walks you through as you're putting on, especially in the isolation rooms, the ante rooms, these are posted so that you know that you're following the proper steps. But if you're more of a picture kind of person and less of a video person, I would encourage you, I'll have Kelly kind of send these out, but I would encourage you to read through these. I'll kind of scroll slowly in case y'all would like to pause and read them. But this is exactly what we discussed with the video. So this is putting them on, and then there's a separate one about taking it off. And again, it walks you through the steps, and these are posted in various areas within the hospital. So there are those. So I promise we're here for you with this. If you have any questions, that's what your faculty are for. That's what your upper level residents are for. The nurses are always very happy to help you. And honestly, our infection control team and the physicians and nurses on that team have also been very beneficial and supportive of our resident trainees, keeping us in the loop. So I promise we are going to take good care of you guys, and we're excited to have you join us and participate in taking care of patients, period, and doing so safely by keeping yourself protected with this equipment and keeping them protected as well. Thank you.